Good morning, everybody. Our today's topic for discussion is lesser omentum. The learning objectives for today's topic are definition of lesser omentum, attachments of lesser omentum with stomach and liver, contents of lesser omentum, and clinical importance of lesser omentum. MCQ type questions at the end of this session are for revision and assessment. Lesser omentum is a double-layered sheet of peritoneum that is typically divided into two parts, the hepatogastric and hepatoduodenal ligaments. As their name imply, these mesenteric structures are structured from the inferior surface of liver to the lesser curvature of stomach, the abdominal portion of the esophagus, and the first 2 centimeters of duodenum. The lesser omentum lies posterior to the left lobe of liver. It forms the anterior border of epiploic foramen and the lesser sac. It is embryologically derived from the ventral mesentery. It is surgically important because of its contents, the hepatic artery, portal vein, and common bile duct. It is also anatomically important because of its location, topography, and attachments. Naming of the lesser omentum. Naming of lesser omentum is defined in relation to greater omentum as the lesser or smaller of the two. The word omentum comes from the Latin omen, which means the fat skin membrane. So lesser omentum is also called hepatogastroduodenal ligament. It stretches between liver and stomach. It also spans between liver and first 2 centimeters of duodenum. And this part of the lesser omentum is called hepatoduodenal ligament. The part of the lesser omentum stretching between lesser curvature of stomach and liver is called hepatogastric ligament. Origin of lesser omentum. As already said, lesser omentum is derived from embryological ventral mesogastrium. Mesentery connects gut tube with the posterior and anterior abdominal wall. Dorsal mesentery remains throughout, whereas the ventral mesentery remains only in the region of the foregut. As a result of development of liver, ventral mesentery is divided into falciform ligament between anterior abdominal wall and liver, and lesser omentum stretching between liver and lesser curvature of stomach and first 2 centimeters of duodenum. What are the attachments of lesser omentum? On one side, lesser omentum is attached to the visceral surface of the liver and also to the superior surface of the liver. As already said, lesser omentum is attached to under surface of the liver and also to lesser curvature of stomach and first 2 centimeters of the duodenum. On the hepatic side, it is attached to lesser omentum is attached to fissure for ligamentum venosum and also attached to porta hepatis as shown by these two arrows. On the side of stomach, it is attached to lesser curvature of the stomach and also to the first 2 centimeters of duodenum. Now, what is free margin of lesser omentum? The surgical importance of lesser omentum lies because of its free margin. The free margin of lesser omentum is defined as a right margin between the hepatic and duodenal attachments. Right free margin extends from porta hepatis to first part of the duodenum. The contents of the free margin are portal vein, bile duct, and hepatic artery. Divisions of lesser omentum. Anatomically, lesser omentum is divided into ligaments, each starting with the prefix hepato to indicate that connects to liver at one end. Most sources divide lesser omentum into hepatogastric ligament, and hepatoduodenal ligament as already discussed. In some cases, the following ligaments are considered part of the lesser omentum: hepatophrenic ligament between liver and right dome of the diaphragm, hepatoesophageal ligament between liver and abdominal part of the esophagus, hepatocolic ligament, the portion connecting liver with colon. What are contents of lesser omentum? Lesser omentum is surgically important because of its contents, especially in the free margin. Between the two layers of the lesser omentum close to the right free margin are hepatic artery proper, common bile duct, the portal vein, lymphaticus, and hepatic plexus of nerves. Between the layers of the lesser omentum, where they are attached to stomach, run the right and left gastric arteries as well as right and left gastric veins and also lymphaticus. As shown in this figure, the major structures within the lesser omentum, or the structures present in the free margin of the lesser omentum are common bile duct, hepatic artery proper, and portal vein. Along lesser curvature, structures present between the two layers of the lesser omentum are right gastric artery and left gastric artery. Left gastric artery arises directly from celiac trunk. In addition to these structures, hepatic nerve plexus is also contained within the double L fold of lesser omentum. This plexus of the nerves contains both sympathetic and parasympathetic fibers. Sympathetic fibers are derived from the celiac plexus, whereas the parasympathetic fibers are derived from vagus, as shown in this diagram. These nerve fibers are distributed to liver along with blood vessels. Clinical importance of free margin. Lesser omentum is important because of its contents in the free margin. The right free margin of lesser omentum forms anterior boundary of epiploic foramen and lesser sac. It contains vital structures. The arrangement of these structures in the free margin of the lesser omentum can be remembered like this. Portal vein, P stands for posterior, P also stands for portal. So portal vein lies posteriorly. Common bile duct, D stands for dextro, D also stands for duct. So duct lies on the right side and anteriorly. A stands for artery, A also stands for anterior. So hepatic artery lies anteriorly and to the left. So because of its contents and topography, free margin of lesser omentum is important in hepatobiliary surgery. Free margin is also important for reduction of internal hernia. It is also important during springless maneuver. Springless maneuver is used to stop bleeding originating either from hepatic artery or portal vein. It is also used to differentiate sources of bleeding from hepatic artery or portal vein and other sources of bleeding like inferior vena cava in hepatic trauma. Now let us go to this diagram to see the arrangement of structures in the lesser omentum. So arrangement of structures in the lesser omentum are CBD anteriorly and to the right, hepatic artery proper anteriorly and to the left, and portal vein posteriorly. Right and left gastric artery is a small abdominal vessel that arises from proper hepatic artery. It runs along lesser curvature of stomach, giving off several small branches that supply its anterior and posterior aspects. The artery terminates by anastomosing with the left gastric artery around the angular incisura of the stomach. Now, what is springless maneuver? In 1908, Pringle described a technique to minimize blood loss during hepatic surgery by clamping vascular pedicle. As you know, liver is supplied by hepatic artery and portal vein. Surgeons must be able to isolate and control these sources of blood flow to control bleeding not only in traumatic injuries to liver but also in elective hepatic resections. Pringle's maneuver allows surgeons to evaluate sources of bleeding in hepatic trauma. It differentiates between origin of hemorrhage from branches of the hepatic artery or the portal vein and retrohepatic inferior vena cava and hepatic veins. When a clamp is applied to the pedicle in free margin, hemorrhage ceases if it is from hepatic artery or portal vein. If hemorrhage continues, the other likely sources of bleeding include the retrohepatic vena cava and hepatic veins. The surgeon differentiates between bleeding originating from hepatic artery or portal vein and other sources. I want to summarize my lecture as lesser omentum is a double-layered fold of peritoneum. It originates from ventral mesogastrium. Right free margin of lesser omentum is surgically important because of its topography and contents. It forms anterior boundary of epiploic foramen and lesser sac. Pringle's maneuver is used to stop hemorrhage originating either from hepatic artery or portal vein. Pringle's maneuver also differentiates between bleeding from contents of free margin and retrohepatic inferior vena cava and hepatic veins. Now let us go for a quiz based on this lecture. Which of the following ligaments is not a part of lesser omentum? Hepatocholic ligament, hepatophrenic ligament, hepatoesophageal ligament, hepatojejunal ligament. D is not a content of lesser omentum? Which of the following is not a content of lesser omentum? Hepatic artery, portal vein, common bile duct, inferior vena cava. Inferior vena cava lies posterior to lesser omentum. False statement about lesser omentum is it is derived from dorsal mesogastrium. It connects stomach with liver. It is free margin forms anterior boundary of epiphytic foramen. Hepatophrenic ligament is a part of it. A is the wrong statement. Which of the following is not contained in the free margin of lesser omentum? Nerve plexus derived from vagus, lymphatic vessels, nerve plexus derived from celiac ganglion, left gastric artery. D is not a content of free margin of lesser omentum. False statement about lesser omentum is developmentally it represents ventral mesogastrium. B. Gastrohepatic ligament extends between greater curvature of stomach and liver. CBD is a content of lesser omentum. In springless manner, its free margin is compressed. B is the wrong option. Which of the following arteries is not contained in lesser omentum? Hepatic artery proper, left gastric artery, right gastric artery, right gastroepiploic artery. D is not contained in the lesser omentum. Right gastroepiploic artery is content of greater omentum. Which of the following is a false statement about springless maneuver? Springless maneuver stops bleeding from hepatic artery and portal vein. In this maneuver, free margin may be compressed up to 1 hour. It stops bleeding from inferior vena cava. It differentiates source of bleeding from hepatic artery and inferior vena cava. C is the wrong option. Which of the following is false about hepatic nerve plexus? Contains sympathetic fibers, contains parasympathetic fibers. Autonomic fibers are distributed to blood vessels. Parasympathetic fibers are derived from celiac ganglion. D is the false statement. Parasympathetic fibers are derived from vagus. Thank you for watching. Do not forget to like, subscribe and share this video.